I was engaged. I was planning my wedding. I was looking forward to starting the next chapter of my life. And I had felt a lump on my right breast. I went from having a very carefree life of planning my wedding and thinking about my wedding dress and what I was going to look like and how I was going to wear my hair and what my bridesmaids were going to wear, to having a breast exam, a biopsy, and then being diagnosed with breast cancer. And at 31, you never think you're going to hear those words. From day one, I always said, I will do everything I can this time around, because I never want to question, if this comes back, that there's something I could have done differently. And so the question to have a mastectomy was never a question. It was, yes, I will have a mastectomy. The wonderful option for me was that I was a candidate for direct-to-implant. And that meant that I could go from going into surgery and waking up with breasts and never having that moment of looking down and not having breasts. And not that breasts define you, but as a woman, it's something that makes you feel womanly and attractive. And to not have that, even if it's for a day or a week or a moment, takes away a bit of your identity.
Hi, my name is Lisa Hunsaker. I'm a plastic surgeon at Littleton Adventist Hospital, and my role with the direct-to-implant process is I'm the reconstructing surgeon. So I work very closely with our breast surgeon, Jody Widener, and the two of us together are able to complete the mastectomy portion of the surgery and then simultaneous reconstruction at the same time.
The direct-to-implant procedure offered here is basically several procedures all combined into one. So we do the mastectomy, and that's my part of the procedure, is to actually remove the breast tissue. And then Dr. Hunsaker steps in and begins the reconstructive process. And that normally is one procedure, all combined at the same time. And so again, my job is to remove the cancer while Dr. Hunsaker then comes in and makes everything beautiful.
The greatest benefit to patients while undergoing direct-to-implant is that they can undergo all of their surgery in one setting. This allows them to have their surgery and have complete reconstruction and be completely managed in one session and be back to their life in 6 weeks. This allows them to get to chemotherapy and radiation if that's needed, and if it's not, they're actually back to their job, their families, their life, having been completely treated. So it's a wonderful time compression that allows patients to immerse in their treatment and simply wake up finished and be able to focus on other issues.
The part I love best about my job is being able to see the patients come back 6 months, 12 months, 2 years later, and they are happy and they are healthy, and this whole process is behind them. And so that is always a huge boost to my day when I see somebody come into my office and they're happy and they're smiling and they say, I kind of forget that I even went through this. It's over, and I've beaten it, and I'm strong, and I'm happy, and I'm good now.